My name is Tara Cox, and I will be discussing the new IntraLase procedure that has been FDA approved within the past 10 years. Advocates of IntraLase claim this procedure is a safer alternative for eyes. The newer procedure, IntraLase, has been touted as the all-laser LASIK. The most significant claim of the IntraLase machine is that it can greatly reduce the risk of flap complications associated with microkeratome-created flaps. LASIK surgery accounts for over 2 million services for vision correction each year and has quickly become one of the most effective ways to maintain good eye health while correcting common vision problems. With the IntraLase laser, the surgeon uses the precision of a laser to create the corneal flap. Because of its consistent accuracy, IntraLase now makes it possible to treat many patients who were dismissed as candidates for laser vision correction due to thin corneas. The typical cost for this type of procedure is around $250 to $500 more per eye compared to microkeratome, with an average cost of around $2,500 per eye. Advantages to this type of procedure include more patients achieving 20/20 vision than compared with a microkeratome blade-created corneal flap. Because the surgeon can determine the depth and diameter of the flap, the result is a more precise and usually smoother cut. The disadvantages include a higher cost, and the procedure takes a little more time to perform, which I will discuss later on. The traditional laser LASIK surgery is a microkeratome blade. It is a precise handheld surgical instrument with an oscillating metal blade. Now, it's used to separate the surface layers of the cornea and create a corneal flap during the first step of laser vision correction surgery. Then the excimer laser sculpts the cornea into the optimal shape. Now, once the cornea is resculpted into a space that improves vision, the tissue is repositioned and healing begins. Now, the typical cost for this is about $2,000 per eye. Advantages include it's generally faster and more comfortable for the patient. The procedure typically lasts about 3 seconds compared to 15 to 20 seconds with IntraLase. Less section is required and less inflammation occurs afterwards. So you've got a lower cost, a longer history of success, and surgeons having greater experience with it because it has been around longer. Complications, though rare, tend to revolve around flap complications. For instance, a partial flap or a hole in the flap. So in summary, IntraLase appears to have better success with less potential complications. However, it does cost more and tends to be uncomfortable for the patient with a longer recovery time.